Hello friends, my name is Dr. Subodh and this is my YouTube channel Learn from Psychiatrist. Now in our previous videos we talked about brain, mind and their functions and how closely they are related in a very simple language. Now in this video I'm going to talk about mind and mental health. Now as previously learned, mind is how we feel and think about ourselves, others and our environment or situations. Now, if we are going to add the concept of time to mind, this will give rise to mental health. So how we feel and think about ourselves, others, and our situation in present, past, and future gives rise to our mental health. So this area between our feeling and thinking and past, present, and future is our mental health. Now, adding the concept of time allows us to understand the dynamic concept of mental health. Now, question is that what is normal mental health or what are mental health problems? Normally, our mental health experiences various or different kind of feelings and emotions and thinking which is usually reactive to our environment or situations, our relation to others, and is governed by a common logical principle. Now, to understand that, I'm going to give you an example. Now, consider myself. I'm a doctor and I'm working. Now, I feel happy about it because I get opportunity to help people. Now, today, in the present, I'm doing a video. If you are going to like this video, probably I'm going to feel happier. If you dislike this video, probably I'm gonna feel upset or maybe unhappy about the situation, so my mood is going to dip. Now, probably it will also give rise to a thought that I'm a bad teacher or I'm very unsuccessful teacher. Now, if I think about my past, probably I can think that I have not been a very good teacher at all, or maybe in future I will not be performing very good. But if I use a common logical principle, I can easily understand that by understanding my mistakes or taking feedback from others, maybe I can improve myself. So in future, I will continue to make videos, I will continue to teach, and probably I'm gonna help more and more people. Similarly, to take an example of a depressed person to understand mental health problems, a person who is depressed, at present, he is going to think low about himself. He is going to feel low. He will rate himself as a loser. If he is going to think about his past or feel about past, probably he is going to feel guilty or bad about something without any apparent reason. And these feelings will be fixed. If you're going to give a logical explanation, probably he will not be able to accept that. In future, he is going to feel hopeless or suicidal. So this is how his mental health is fixed, is not governed by a logical principle, and there is no mixture of emotions or feeling. It's just usually one emotion, that is low mood or sadness. Now, talking about a person who's having some anxiety, at present he is going to struggle with his self-image. Probably he will be more conscious. He will be doubting himself. If he is going to think about his past, probably he will think in a similar manner that he has never been a good person or a confident person. If he is going to think about the future, he is going to doubt about himself. If he thinks about others, probably he is going to rate others better than him without any apparent reason. He might be better than others, but his thinking is fixed. His feelings are fixed. At present, he will consider himself as inferior, and in future, he will continue his thinking. It will be fixed. If he thinks about situation, probably he is going to think situation as really dangerous or difficult. That means he might avoid going in a social situation. It could be in the past, he could experience normal situation as threatening or humiliating. Therefore, he will think like my present situation are not favorable, or in future he will try to avoid busy situation or social situation, or maybe he will avoid performing in social situation because he is anxious. So in this manner, his thinking is not governed by a logical principle, is fixed, and his mood is according to his thinking is fixed. Mostly it's low. he is going to doubt about himself, he is not going to feel positive, and even if you're going to give him a logical explanation or rationale, he is not going to change his thinking or feeling. So these type of problems constitutes mental health problems. That's not a normal mental health. In a normal mental health, your mood is going to vary, your thinking is going to vary, it's going to react to your situation or relation to other people. So a normal mental health is reactive. It's a mixture of different kind of feeling and thinking, and is governed by a logical people. When these three things are disrupted, probably people are going to experience mental health problem or an abnormal mental health. So I have tried the most simple way of explaining mental health and mental health problems, but I might not be successful telling you or making you understand. So what you can do, you can actually raise any query, you can comment below, and you can ask any question you want, and I'll be more than happy to answer your queries in best way possible. Now subscribe to my YouTube channel, follow me, and I'll see you again in next video. Till then, take care. Bye bye.